Hello, I'm just going to give you a little brief talk on blood gas interpretation. I'm going to really keep it very simple, not go into all of the details of things you can get on a blood gas machine, but I'm going to focus on very few, very most important things, because that's how I quite like doing it myself, to be honest, keep it really simple. So first of all, we think about obviously our child. The reason we're going to be doing a blood gas is generally that they're unwell. I want to know something about their pH. So we have to think about the child as basically a bag of organs, and if you think about all human beings as systems that breathe in oxygen and out carbon dioxide, and we're constantly absorbing or excreting hydrogen ions by our kidneys, and we think of our ability to balance pH within a really close number, which I tell you now is 7.35 to 7.45. We look at these blood gas results and we think, is this an acidosis or an alkalosis picture? And then we think, is it due to a respiratory problem or a kidney or / what we call metabolic problem? We can obviously look for the results on a drop of blood, and do that by using one of these finger prick devices, a small dollop of paraffin on the finger and a scratch on the finger. We should get a small amount of blood into a capillary tube, which goes into a blood gas analyzer. You can also use a syringe to take blood and place it into the gas analyzer, but we tend to use capillaries more frequently in paediatrics because it uses a very small volume of blood, a quarter of a ml, and it gives us good results. So now looking at a very brief blood gas result like this one. This doesn't show the results obviously that you get in a blood gas, it just focuses purely on pH and CO2. The first question asked is the pH high or is it low? You often have the normal ranges on the bottom of a blood gas result, so don't worry, you don't have to memorise these. pH 7.25 is obviously low if you look at the normal range there. That means this blood is acidic. The next question you ask is the CO2 high or low, and does it explain the pH? So let's just go over that for a second. The pH is low, that means this blood is acidic. The CO2 is high, that means the CO2 does explain the pH. That means this is a respiratory acidosis. Okay? Because the CO2 does explain the pH, that means it's respiratory problem, and because pH is low, that means it's respiratory acidosis. Okay? We can just quickly flip that and imagine the pH was high and the CO2 was low, that would be a respiratory alkalosis. So, next one. Remember, CO2 is acidic, okay? Bicarb and base is alkaline. Base is in fact just another word for alkaline. So this new gas, we've got the pH, is it high or is it low? This one's obviously high. Does the CO2 explain the pH? No, it does not. This CO2 is low to normal. It's not likely to be making the blood alkalotic then, isn't it? pH, if the CO2 isn't very low, this 4.3 is within the normal range. The base excess is positive 5. So this is a bit of a confusing terminology, which I don't really like. An excess of base is an excess of alkali. So if you've got a positive value there, that means you do have an excess of base, which means that your blood would be alkalotic. That means this is a metabolic picture, okay, because the CO2 didn't explain it. The base excess does explain it. So this is a metabolic alkalosis, okay. Another one, pH 7.25. Does the CO2 explain the pH? The CO2 is low in this one. It does not explain the pH. That means this is not a respiratory picture. The base excess is minus 5.2, so we've got a minus value of excess. That means we do not have an excess. Silly double negatives. It means that the base excess does explain the acidotic value, okay? Because you don't have alkalosis, means that we do have acidosis. This is a metabolic acidosis picture. Okay. So common things that might come up in your exams, common problems we see on the ward, like a common respiratory acidosis picture is respiratory distress syndrome. The baby's up on special care, newborn babies who are struggling to breathe, or babies downstairs who are struggling to breathe because of illnesses like bronchiolitis. They have respiratory distress syndrome, and they commonly have a respiratory acidosis. So think about this in your head. The pH will be low and the CO2 will be high. A common respiratory alkalosis picture is often a teenage person who's having a panic attack and breathing really rapidly. Hyperventilation causes you to breathe off your CO2, so CO2 level will be low, which will cause the pH to go up, and you get a respiratory alkalosis picture. A very common metabolic acidosis picture is diabetic ketoacidosis. So these patients have obviously high blood sugar levels and have developed high ketone levels. The ketones are acidic, which causes your base excess to go down, which causes then your pH to go low. Okay, so that's a metabolic acidosis picture. And a common metabolic alkalosis picture is a pyloric stenosis. These babies vomit so much of their hydrochloric acid. That means that they lose lots of their hydrogen ions, which means that their pH goes up. And that's all because of a pyloric stenosis. Best thing to do is to keep looking at blood gas results, looking straight for those two questions. What's the pH? Is it high or low? And does the CO2 explain it? That gives you a pretty universal way of coming to the answer. Is this a metabolic acidosis, alkalosis? Is it respiratory acidosis or alkalosis? Hope this hasn't been confusing. If you've got any questions, please hit me up and grab as many blood gas as you can and practice this in your own time.